All right. Many people have been there dealing with flu symptoms all of a sudden, an injury at work or play, whatever, or just simply needing some routine care. Our next guest says that the Avecina Medical Clinics can offer you the care you need. Dr. Saman Soleimani is joining me right now. He's the president and CEO of Avecina Medical. Appreciate you joining us.
Thank you, Curtis.
So let's talk about this. For those out there who may not have, Avecina, if you haven't seen this around town, the 3 locations, tell folks about you.
We're basically an urgent care center with 3 locations around town. We have a location in Juleston Creek at the Oakleaf Town Center and by Tinseltown, block north of Touchton. We pretty much provide walk-in urgent care for a whole host of conditions, whether it's cough, colds, sprains, sutures,
So this is, as far as things you treat is pretty much anything you would hear about at an emergency room or even just a general doctor.
Yeah, short of being a trauma 1 or 2 level type condition or having a stroke or a heart attack, we pretty much treat it all at Avecina. It's a multi-faceted practice.
So you guys are seeing everything that runs the gamut there.
Pretty much.
And you mentioned the locations, but how accessible are Avecina's offices? I mean, the hours.
We're open 7 days a week. The beauty of it is we have many patients that use us because they don't have to take off work because of their conditions. They may have to come at 5 o'clock, 6 o'clock. They may have to come on a weekend. So that makes it very accessible. We're open 8 a.m. to 8 p.m. Monday through Friday and 8 to 5 on weekends. So it makes it very accessible. And our locations, the 3 locations were very purposefully plotted in a sense that almost no matter where you are in Jacksonville, you're probably no more than a 15-minute drive to any of our locations.
Yeah, you really kind of placed them. If you look on the map, they really placed them, kind of spread out.
It really triangulates the city well.
Yeah. Good job doing that. That's, I looked at the map and I was like, dang, that's like perfectly spread out. All right, so what about as far as when patients come in there? The next question people are thinking out there, all right, well, how does my insurance work there? Do you guys see insured patients, self-pay patients?
Sure. We really don't turn away anybody. We are in line with every insurance company. I mean, whether it's Blue Cross, Cigna, United, we take Medicare, pretty much every different types of Medicaid that's available. Avecina also takes Healthy Kids, and Better, Sunshine, Molina. So we take pretty much, if you have insurance, we take it. We do not determine those rates, so whatever, if you have a deductible or copay, that's predetermined by your insurance company. And then we have many patients that use us because they don't have insurance and they have difficulty getting access to medical care other places, and we have very, very reasonable self-pay rates that are just specifically designed to help the patients that don't have health insurance.
That's extremely helpful. And do you have people on staff, obviously, helping people through navigate the payment?
Absolutely. We have a very dedicated front staff that, whether patients are calling or if they have a question, sometimes it's harder to give a quote to somebody, but they can give them a general idea, as in, hey, if you have a cold, it's probably going to cost this much, or if you have a sprain and it requires an x-ray or so on, it may cost this. So they'll definitely guide them through, but if they come into the office, we can obviously be much more in detail as well.
Well, then let's talk about that. So somebody out there right now watching wants to come, they got some kind of flu symptoms, cold, or a cut. How do they come see you? Do they have to call ahead, or can they just show up?
Not at all. That's the beauty. It's a walk-in, no appointments needed. We keep track of the data, and 97% of the visits from the time you walk in until the time you walk out is 45 minutes or less. So that's kind of the beauty of it, which is, in essence, shorter than, including myself, where I've seen physicians where I've had an appointment where you sit, everyone's had that experience where you sit in the waiting room for 2.5 hours. When you actually have a slot at an appointment, patients really love the fact that they can come in and be in and out in 45 minutes to an hour, with a diagnosis or a prescription in hand.
How long have you guys been in town?
2004, so it's 14 years now.
Been in town 14 years, yeah. And it just seems over the last 10 to 15 years, that need has increased, because like you said, is that the feedback you're hearing from people, why they keep returning, is it's just so much more convenient?
For sure, primary care physicians, pediatricians, they're kind of bombarded with patients. They have limited hours. Most are open, 8:30 to 4:30. They take a lunch break. They can only see so many patients. So for us, when we're open, essentially more than 80 hours a week, we're open twice as long hours-wise per week than a typical office, and we have more providers, more staff, so we can just take care of a lot more patients. So many patients, when they call their primary care and they can't be seen sometimes for days or weeks, it's a very easy access that they can just come walk in, be seen, in and out in 45 minutes.
Yeah, that's nice. That can be frustrating when you have something you want to get checked out and you can't go see anybody for weeks.
Absolutely.
Very cool. Appreciate you being here, and thanks for
sure.
sharing the information. Special thanks to Avecina Medical for being here and sharing this information. And for more information and a look at their services, visit avecina.com. Remember, they have 3 locations in Jacksonville.